I'm one of the co-chairs for the World Institute of Pain's World Congress for next year. So this year we had fully planned on providing an in-person meeting in Budapest, because that's Dr. Ratz's 25th meeting. Unfortunately, we've had to cancel the in-person meeting because, of course, COVID has affected a lot of things. So we were planning a virtual meeting, and so we're in the process of kind of finalizing those things. And one of the things that we're trying to do for the Dr. Ratz's meeting every year is a big preparatory course for the FIPP exam. And so that's always been a big component. Fortunately, I took over from Dr. Hebner running the cadaver, the teaching sessions and things. But we're trying to put together live patient videos. So we had a meeting this past Tuesday morning, and it's kind of crunch time trying to get several of the physicians who are good teachers to get live procedures videotaped, and those procedures will be some of the ones that would be tested for in the exam, so that those can be presented during the virtual meeting. So physicians who are interested in taking the meeting taking the FIPP exam will be able to use it as a teaching session to see step by step how to do these procedures. So hopefully when I believe this year the exam board has decided not to hold any FIPP exams. Of course, that could change. And so next year, hopefully, we'll be up to speed and back to normal like we were in non-COVID times. The World Congress next year in Budapest, we are in the process of finalizing the scientific committee. I'm working with Dr. Stotz and 4 other members of the co-chairs to finalize the scientific committee so that we can start working on publicizing that and encouraging other physicians to submit topic sessions and to submit names that they would like to have. And so it's getting kind of exciting, even though we are, a year and several months out. It's always like, okay, we're behind. It's kind of like, we got a year. But time goes fast, and hopefully you have all your ducks in a row and just kind of finalizing things. And Sandra Vamos, she's always been very, very helpful with that. And so I get an email every day, what about this, So we're trying to, stay on top of things like that. But slightly disappointed for this year's Budapest meeting, especially since it's the 25th. But at the same time, I think we're still excited to try to be able to, give something virtual. Everybody's kind of by now a little zoomed out. I think in the beginning it was great platform, but now it's just kind of like another one. But, I can't control that. We cannot control these times, and we're trying to make the best of it that we can. But lots of exciting things coming down the pipes. My latest amount of time is just focused on teaching fellows and trying to keep them in order. I'm trying at this time to update a sympathetic evidence paper that I published, I think, in 2008, and trying to do an update on that. So I'm working with one of my residents who's kind of gotten things together, and I just have to put it together a little bit more, and hopefully within the next 6 months try to get that published. But other than that, we're trying to encourage, we've been talking with industry, trying to bring some new techniques to the fellowships, like SI joint fusion, percutaneous fusions, and the Health Science Center has made a brand new state-of-the-art cadaver facility, main lab for the medical students in occupational therapy and physical therapy. But they've also designed some other smaller rooms that specifically designed to do teaching. They've got beds and C-arms. They've got the lights with the cameras on them that can be televised, So that's about what we got going now. I always say nothing, of course, the human body, a live body is different than a cadaver body is different from a simulator. In the absence of being able to get cadavers, simulators are helpful, but I'm kind of like old school. Simulators, yes, they serve their purpose, especially in some other countries where cadavers are not available, like when I go down to South America. And and a lot of things that we do is just feel, and the sensitivity and knowing tissue planes and things like that. So as you get the simulators and everything looks, of course every body is different. You get the simulators, everything is very crisp. And you're kind of, okay, yeah, this is not like a real body, but we'll use it, for the time being. But I think they do serve their purposes. I think, like you said, there's a few companies that have them. I think ones that, I just say they're needed, and hopefully, especially even with cadavers, I mean, the willed body programs at some of the universities, so it's kind of ebbs and flows about who's donating their bodies to science, and so sometimes cadavers are hard to get. And cadavers are expensive too, the whole the cadaver, the spulls, and all that stuff. So simulators, good simulators, I think do have a place, and especially if they're less expensive. And in such situations, certain countries where you can't get cadavers, I think they have a good purpose. So I think the better it gets, that they're able to simulate real situations, real feeling. I'm sure that will happen in the near future. Yeah, because I was reading something about, well, actually I was watching a documentary about the medical field, and they were talking about the Da Vinci device, using that for surgery, and how it's kind of like electronic health records. You take a 60-year-old doctor and say, okay, now you got to document everything in an electronic health record because it happens at our clinic, and they're like, I would rather just write a note. I can't do this. I mean, I got to do this, I got to do this, I got to do this. So, the whole thing, you can't teach an old dog a new trick. I think sometimes, yeah, it's true. Your 5-year-old can whip out your phone, and you're like, how the heck did you do that? And even though I was never good on video games, I'm pretty good doing procedures and stuff. And one of my former fellows did a study where he's looking at surgery residents who did a lot of gaming were actually better technically surgeons because of all the finger movements and stuff. So, but I think, like you said, you kind of get an idea of what it's like rather than just first day, here's a needle or here's a surgery and go for it as your first one. And so, but the Da Vinci thing, they were talking about how doctors were using the Da Vinci, but not really, in their first case, they hadn't done enough training, and how it was leading to complications with the Da Vinci because there wasn't enough training. That they said initially you got to do this, but then as time went by, it was less and less and less and less until it's like, oh, you got to have proctored on one Da Vinci and you can go for it, when it used to be 10. So even though they had these awesome devices, it actually was causing more complications because they really weren't properly trained. So I think, with bringing in sim stuff, there's got to be a good training process that needs to be adhered to, and not over time we go, yeah, we don't have to do that either. No, you'll be okay. I've seen you, you'll do fine. And then something happens and you got to go back and look at the training. So, but anything that makes healthcare professionals better at what they do and safer, it's really safer, I'm all for it. I'm always big with education. And I think, the one thing I love, well, I'll talk about the World Institute of Pain and AFIPP and two different things. I think the World Institute of Pain is, has a place in the world, because we in the United States are very fortunate that we have accessibility to many meetings, we have accessibility to training centers, we have accessibility to even cadavers to get taught on things that we need to do for our patients. The rest of the world, it's lacking. Even, certification is lacking in other countries, and that's why a lot of young physicians or even older physicians in other countries come to the WIP to get trained because they go back to their countries. So I always encourage everybody who goes to WIP meetings, who eventually becomes an FIPP, to go back to their country and to take somebody under their wing to help foster their education and encourage them to go through the same process. And so I teach my fellows, I always tell them that, you're just very fortunate that you have this training. Other countries don't have this training. I think AFIPP is very important as well, because AFIPP has taken, has always been at the forefront of not only, providing meetings, educating physicians, and they have their own ABIP exam, but also legislatively. I mean, it's one of the few societies that are truly, for us, interventional pain management physicians. I'm an anesthesiologist by training, but I do pain management, and people ask me, well, do you support the the American Society of Anesthesia, and I say no, they don't represent me. They represent anesthesiologists as a whole, and there's thousands of more anesthesiologists than those of us who practice pain. And so I encourage people to join ACIP, donate to ACIP, because they speak for us when nobody else will. And they put their money where their mouth is. And so I think it's important to be part of both organizations